Welcome to the session about the AIMS May 2019 ophthalmology questions. So our first question was that the patient presented with the following condition, what should not be done as the part of treatment immediately? Now there was a controversy whether this term immediately was there or not. So let's say immediately word was mentioned. Now here when the immediately word is mentioned, then your answer would be remove the nail. This modality, removing the nail, should not be done in the open setup. It should be only done in an OT. How to do it? Let's say this is your eye, this is your cornea, and this is the surrounding scleral port. So what we do is we make three ports like a vitrectomy, and then we secure the posterior segment. We put fluid inside the posterior segment so that when we have to remove the nail, the posterior segment does not collapse. Now let's say we remove the nail immediately without any support to posterior segment. The chances are there through this perforation, the content, the intraocular content can also come out. Okay, so that's why removing the nail is to be done only in the cases where there is a OT available. Okay, don't do it in the OPD portion. Yes, you have to check the visual acuity and you have to give antibiotics. Now, why visual acuity checking is important? Some students are saying that why, sir, it is important. Very important is its medical legal value. Let's say if it is a medical legal case and the you have not recorded the visual acuity, and post-operatively the patient says that I was having good vision earlier, but after the surgery I have got a no vision. So why this has happened? So the doctor may be in the soup. So always check a visual acuity. Also it is important for the prognosis of the case, and whether you if the visual acuity is very bad and the perforation is more peripheral, so then you can basically think that there may be an internal injury also, or let's say there can be some vitreous hemorrhage or retinal detachment also. So it is also important for the prognosis in this case. Then whenever there is an open globe injury or there is a perforation, you have to give the antibiotics. Now the controversy was regarding the option D. What is primary survey? Primary survey, let's say if they are asking about the ABC, that is the airway, breathing and the circulation. Now normally in the ocular trauma, you don't do a primary survey. The patient may be breathing well, but sometimes there can be an oculocardiac reflex. So primary survey is a question mark. So what my opinion here is, if the immediately word is there, then your answer should be A. If immediately word is not there and the question is the patient presented with the following condition, what should not be the part of treatment, then the answer should be D, that is the primary survey. Remember, you have to eventually remove the nail. You cannot make the patient lie down, or you cannot make the patient to have all his life going on with the nail. So maybe it is not an immediate measure, but definitely it is a measure that you have to take. You cannot make the patient live with this nail. So answer here, if immediately is mentioned, should be A. If immediately is not mentioned, then my answer here is D. Next question they have asked, that they have given a picture and asked this test is used for which purpose. So basically this is a random dot test and it is used for measuring the stereopsis. So A is the answer. Now what is random dot test? Here as you can see that there is a Polaroid glass, and with the help of this Polaroid glass the patient sees the image. So this is called a random dot test. The other test that can be used to measure the stereopsis is a TNO test. Here in the TNO test, can you see here? This is a colored image where there is a fly and the patient uses a red-green glass to measure the stereopsis. The other test that can be used to measure the stereopsis is Lang's 2-pencil test, synaptophore, and the Titmus test. So you should just remember the name of the other tests. So the next question was match the following, where drugs were given digoxin, hydrochloroquine, amiodarone, and systemic steroids in one side, and their ocular manifestations were mentioned in the other side. The digoxin causes yellow vision. The hydroxychloroquine is important because it can cause retinal toxicity. Amiodarone can cause optic neuropathy, and systemic steroids can cause cataract. Remember, if they ask about the topical steroids, then they cause glaucoma more, and systemic steroids cause cataract more, and that too mostly the posterior subcapsular cataract. Please revise the ocular manifestation of systemic drugs from my OME notes. So next question was a controversial question. The question was first order neuron of the visual pathway. Now, according to most of the ophthalmology books, as you can see here in the reference also from the PG Ophthalmology by Dr. Vanati ma'am, here also it is very clearly written that the bipolar cells are the first order neurons. So I would go here as answer as C, that is the bipolar cells. So the next question was that they have given a test and asked about true options. So this is basically a swinging flashlight test. And as you know, the swinging flashlight test is done for the Marcus gun pupil. Okay, so this is swinging flashlight test. So your options were Argan-Robertson pupil. This is wrong because the Argan-Robertson pupil have accommodation reflex present and pupillary reflex absent. Named after Marcus gun, definitely correct. Paradoxical bilateral dilation and optic neuritis. This is also wrong because when you show the light to the normal eye, the diseased eye basically instead of having a consensual reflex gets dilated. Okay, so here the right eye gets dilated, and the option D, right eye is normal, that is also correct because the dilation phenomena is in the right side, so right eye is abnormal. So here the answer would be named after Marcus Gunn, US physician. The next question was after uncomplicated cataract surgery with IOL implantation in a young person, which of the following is a true statement? So IOL replaced every 10 years? No. Never replaced? Yes, it is the correct statement. Replaced when secondary cataract develops? No. Whenever there is a secondary cataract, you have to do, or also we call it after cataract. So here you do a YAG capsulotomy. Okay. Remember a term that is also called complicated cataract. The complicated cataract is the cataract that develops due to intraocular conditions like retinitis pigmentosa, uveitis. So these are called complicated cataract. So in secondary cataract, the treatment is the YAG capsulotomy, and there is no replacement as such that has to be done. Replaced when presbyopia develops. So whenever there is a presbyopia, you don't have to replace the lens. What you have to do is to give a NIRAD, or during a cataract surgery you can put a multifocal IOL. So answer here would be B, that is never replaced. So the next question was a 18-month-old child present with the inward deviation of eye. What test would we would do? Or the second, some student says that what is the best investigation that can be done? So remember, an 18-month-old child with deviation of eye. So it can be just a congenital squint, but you have to rule out possibility of retinoblastoma. So that's why we have to do an examination under anesthesia. The main advantage with examination under anesthesia is that you can do multiple things. You can do refraction, you can do a fundus examination, what you can do is any anterior segment examination, keratometry, lens aspiration, or sorry, lens status changes, and also if you get any problem you can do a laser also in the same sitting. So the best answer here is examination under anesthesia. So the next question was, a diabetic female came for eye checkup. When should you call her for the fundus screening? So very easy, a repeated question. You have to do the fundus examination immediately. So here you don't know about whether it is type 1 or type 2. So we considered it as a type 2. And in type 2, there has to be an immediate screening. And in case there is a type 1, then it's better that you do within 5 years of diagnosis. But if nothing is mentioned, consider it as a type 2 and do an immediate evaluation.